welcome back to the channel. If you're something for the first time, you're welcome. My name is Yolona and I am a registered nurse, a registered midwife, as well as a professional makeup artist. And over here we discuss all things pertaining to faith, health, nursing and makeup. So if these are the kind of content you're looking out for, please do not hesitate to like, to share, as well as subscribe to the channel. When it comes to reproductive health, it is very crucial to make informed decisions or informed choices. That is why it is important to be knowledgeable about the different birth control methods that are available. And I know that with so many methods available, it can be very overwhelming to navigate through it, but don't worry, that's the reason why we are here, to break everything down for you. Now, as a way of kickstarting this video, what exactly is birth control? Birth control or family planning simply refers to methods put in place to prevent conception or pregnancy. And these methods vary from hormonal method to long-lasting method to natural method as well as barrier method. And what are the advantages of carrying out birth control? One advantage is that it helps to reduce population growth. It also reduces the risk of infant mortality. It reduces the incidence of adolescent pregnancy. It also reduces the incidence of STDs as well as STIs, which are the sexually transmitted infections and the sexually transmitted diseases. It also reduces the pregnancy-related health risk that happens in women. Now, having said all that, what are these different methods? Now, one method we have is a natural method, which I'm going to start with. Now, in the natural method, it actually is called natural because it does not involve the use of any form of pill, which could be called medication, as well as device. Now, in this natural method, the woman is only taking note of her menstrual cycle, trying to study and notice when her fertility window is, or ovulation period, or a fertile period is, as well as the man gaining mastery of his body. The advantage of this method is that it is very inexpensive because you are not purchasing anything per se. Also, it is a very safe method, okay, for in case of reactions or no reactions. You're not putting on anything, you are not taking anything, you are not using anything, do you understand, externally. And also it is accepted by every religion and every country. There's no religion that's going to say they're against this natural method. The disadvantage of this method is that it's not suitable for all women. It does not protect against any form of STDs or STIs, and also if it is not followed effectively, it might not be accurate. But now, under the natural method, we have different subtypes. Now, one type we have is the withdrawal method, simply when the man has to withdraw his penis from the vagina just before ejaculation takes place. Now, this type is actually the most ineffective, simply because the timing of ejaculation can be quite difficult. That's why I said the man has to gain mastery of his own body. Secondly, we have the calendar or the weaving method. Now, this involves the use of a calendar to be able to track your menstrual history and ascertain when you are going to ovulate. Thirdly, we have the cervical mucus method. Now, in this cervical mucus method, we are taking note of the pattern of your cervical mucus. How does it look like now, in order to ascertain whether or not you are fertile, that's at your fertile window or safe period or not. We also have what we call the symptothermal method, which involves a combination of both observing your temperature, daily temperature, as well as looking out for the symptoms associated with fertility, which includes your cervical mucus secretions. We also have what we call the lactational amenorrhea method. Now, this only works in women who are breastfeeding exclusively. What the woman has to do is that when she's breastfeeding, she can involve herself in sexual intercourse, simply because during this period of time she's not going to be seeing her period. But this method doesn't work for every person, because for some person, the fact that they are not seeing their period doesn't mean they are not ovulating. So, like I said, this natural method is not suitable for all women. Also, we have abstinence. Now, in abstinence, you are simply avoiding any form of sexual intercourse, and it is the best method, that is the surest method of preventing pregnancy, whether it be natural or any other method I'm going to talk about. This is the perfect way of preventing pregnancy if you don't want to get pregnant, okay? Finally, we have the basal body temperature method, which involves you as a woman taking note of your daily body temperature reading every day before you get out of bed What's your temperature like? So any slight shift in your temperature, like 0.2 to 0.5 degrees Celsius, then you notice that, okay, during this period of time, I am actually fertile. If I involve in sexual intercourse, I am going to get pregnant. Okay. Now, when you are taking note of all these signs, you ensure that you are involving yourself in sexual intercourse outside this period of time that you know that, oh, if I have sex, I will get pregnant. That's the essence of this method. Honestly. Now, let's look at the hormonal method. We are done with the natural method. Now, in the hormonal method, it simply makes use of the hormone estrogen and progesterone to prevent pregnancy. Now, under the hormonal method, we have what we call the COC method, which is a combined oral contraceptive. Now, in combined oral contraceptive, it is a pill that contains both hormone, estrogen, as well as progesterone. Now, this pill works by preventing ovulation from taking place, as well as thickening the cervical mucus in the woman, so as to prevent the sperm from getting to the egg and fertilization taking place. Now, having said that, what are the advantages of this type? One advantage of this is that it can be very effective if followed accurately. And I say this because it's a short-acting type of birth control. Hence, you have to be taking this pill every day. So just skipping one day is an issue. Also, women who have endometriosis, women who suffer from heavy bleeding or painful periods, they can actually take this pill. It's very good for you because it helps to reduce the symptoms that are associated with these conditions, as well as these symptoms. And finally, it doesn't interrupt sex in any way. Anytime you're ready for sex, you can actually have sexual intercourse. Now, what are the disadvantages, of this pill? Because everything that has an advantage has a disadvantage. One thing is that individuals are definitely going to experience side effects because it's a medication. So side effects like mood swings could happen, breast tenderness, headaches, all this could happen. Also, women who take this are at risk of coming down with blood clots, having blood clots in their body. It happens. And also, finally, another disadvantage is that it does not protect against sexually transmitted infection or STDs because you are taking it orally, so it doesn't give that form of protection. Now, let's move over to the next type we have is POP, or the progesterone only pill. And like the name implies, it contains the hormone progesterone only, and it acts by doing exactly what the combined oral contraceptive does, which is to prevent ovulation as well as thickening the cervical mucus. Now, one thing I would say is an advantage of this POP or progesterone only pill is that it can actually be used when you're breastfeeding. So as a mother, a new mom, you can actually take this progesterone only pill and it doesn't affect you or your baby. Every other advantage and disadvantage is similar to that of the combined oral contraceptive. Now, another type of hormonal birth control method we have is injectables. Now, by injectables, I simply mean injections that contain hormones that help to protect against pregnancy. Now, what it does is that it prevents ovulation from taking place, and by preventing ovulation, it prevents the egg from being released. Once the egg is not released, there is nothing to be fertilized by the sperm. Now, these injectables are of two types. We have the one that protects the woman for a month and the one that protects the woman for 3 months. So you are safe for a month if you take type A, and you are safe for 3 months if you take the other type. Okay. Now, what are the advantages of this type? One advantage, it lasts for a longer period of time as compared to the ones I've talked about before, the pills I've talked about before. Secondly, it is actually quick and painless. It's not a long procedure. I mean, it's just an injection. And also, and finally, I would say that women who have incidences of heavy menstrual flow, this type of birth control is actually very good for you. Now, what are the disadvantages of this type of hormonal birth control method? Now, since it is an injectable, it has to be administered by the healthcare provider in the hospital setting. For some women, they experience spotting during this period, but this spotting actually goes back to normal. What I mean by spotting is slight bleeding, but everything goes back to normal after a while. For some persons, they find it difficult to get pregnant even after a year of using this injectable, but after a while, we go back to normal. Also, for some women, they don't even see their period at all. Anytime they are using this injectable, they don't see their period at all. Everything, all this I'm talking about, goes back to normal after a period of time. And finally, it doesn't protect against sexually transmitted infection or sexually transmitted diseases. But having said that, when it comes to this type, you have to ensure that you have some form of protection during the first 7 days of taking this injection, simply because it doesn't start acting until about 7 days later. Okay, so the fact that you have taken the injection now doesn't guarantee that you are being protected already from from getting pregnant. So my advice would be, ensure that you are either abstaining from sexual intercourse within the first week or first 7 days, or you are using some form of protection like the use of condom, so as to be safe. Another type of hormonal birth control method we have is the use of vaginal rings. Now, vaginal rings are actually flexible rings. They look like rings, but they are flexible because they're made of plastic, and they contain the hormone estrogen and progesterone. They're inserted into the vagina, and gradually the hormones are being released and absorbed by the body for it to have its effect. It works by preventing ovulation. I've explained what I meant by that. And these vaginal rings are of two types. You have the reusable type and the non-reusable type. Now, for the non-reusable type, you discard it every month and use a new one. Now, how it works is, once you insert the vaginal ring into your body this week, for example, for the next 3 weeks, you can keep it on. But on the 4th week, you are taking it out, and by the 5th week, you are inserting a new one. That's if you are using the non-reusable type. Let me recap. If you have the non-reusable type of vaginal ring, you insert it in your body this week. Week 1, week 2, week 3, you are using it. By the 4th week, you discard it. By the 5th week, which is a new month, right? The first week of a new month, you get a new vaginal ring. But if you are using the reusable type, which you could use for about a year straight, then you just have to reinsert the one you're already using. That's, you reinsert it back to you. That's on the first week of the 2nd month. That is the 5th week. I hope you understand what I've explained. Finally, we have what we call the birth control skin patch. Now, this skin patch contains the hormone estrogen and progesterone, and it works by preventing ovulation from taking place, thereby preventing conception in general. Now, this patch can be applied to different regions of the body, which are the buttocks, the upper arm. It can also be applied to the lower abdomen as well as the lower back. Those are the regions where you can apply this patch to. And this patch, you apply a new one every week. So on a weekly basis, you apply a new patch, and on the 4th week of your 1 month application, you ensure that you take out the patch and allow your period blood to flow. I don't know if you understand. What I mean is, first week you apply a patch, 2nd week a new patch, the 3rd week a new patch, the 4th week no patch at all. Allow the blood to flow. The 5th week, which is a new month, you can apply another patch. Simple. Now, the advantage of this is that you don't need any healthcare provider's help. You can do it at the comfort of your home. Also, it's actually inexpensive. But the disadvantage of this is that it doesn't protect against STIs or STDs, and it can be quite visible. Okay, so you have to wear some certain clothes to ensure you are covered up and everybody doesn't know that this is what's going on. Now we're done with the hormonal method. Let's go over to the barrier method. Now, for the barrier method, we have the use of condoms. Now, these condoms could be the female condoms or the male condoms, which are like plastic, and they are worn in the vagina and over the penis to prevent the sperm from getting to the egg and preventing ovulation from taking place. Now, one advantage, which I feel is the greatest advantage of this, is that it protects against STDs and STIs compared to every other type or method out there. It protects against this, and also it is very affordable. Okay, it is very affordable, and it's something that you can do from the comfort of your home. Those are the advantages of this type, that is condom type. Another type we have on the barrier method is the use of diaphragm. Now, I'm going to insert a picture on the screen. The diaphragm is simply a dome-shaped cup. It is made of latex, okay, and it is inserted into the woman's cervix, not the vagina. The the cervix, and it is used in combination with spermicide. Now, spermicide are simply creams that help to kill any form of sperm. Now, what this does or how it acts is that it prevents the sperm from getting in contact with the eggs and prevents fertilization from taking place. The advantages of this method: it is highly effective if accurately done. It can actually be used when you are breastfeeding, so it doesn't interfere with breastfeeding, doesn't affect your baby in any way. And finally, it is easily reversible. So if you want to get pregnant the next day, you can get pregnant the next day. All you have to do is to take it out. Okay, it's easily reversible. Now, disadvantages of this is that since you're inserting it into the cervix as opposed to the vagina, insertion can be quite difficult. Okay, and also it has to be inserted 6 hours before sexual intercourse. Yes, and doesn't protect against STDs or STIs. Now, another type we have under the barrier method is the cervical cup. Now, the cervical cup is simply a plastic cup that is inserted into the cervix through the vagina into the cervix to protect against pregnancy. It works by preventing the sperm from reaching the egg for fertilization to occur, and it's also usually used in combination with spermicides, which helps to kill sperms. Now, what actually happens is that for this cup, it is reusable. That's one of the advantages. It is reusable and it's very affordable, so you can even use the cup for up to a year as far as you are maintaining and taking good care of it. It is easily reversible as well, and it can be very effective if accurately done. The disadvantages are it doesn't protect against STDs or STIs. It can be difficult to insert because you are inserting it in the cervix, and it's actually given based on prescription. Yes, it has to be prescribed. If you know, you know. Okay, it has to be prescribed. And finally, you have to have it on 6 hours before sexual intercourse. Now, having finished talking about the barrier method, let's go over to the long-acting methods of birth control. One thing about long-acting, just as the name implies, it provides a long-term protection or prevention from pregnancy. Now, one we are going to look at is implants. Now, I know that implants are very common. Implants are just flexible rods that are inserted into the upper arms, and they protect against pregnancy by thickening the cervical mucus and preventing ovulation from taking place because it contains the hormone progesterone in it. Now, what are the advantages of this? Like I said, it is long acting, so you are covered for 2 years, 3 years, 5 years. Yes, that's how long you can be covered from getting pregnant. Also, it is very, very effective. Actually, it's very effective. The disadvantages I would say include it doesn't protect against STDs or STIs. It has to be inserted by the healthcare provider because you can't do it by yourself or from the comfort of your home. And finally, I would say it usually causes, for some women, vaginal bleeding. They will experience vaginal bleeding or spotting, okay, slight bleeding. Some women experience it when they have implants on them. Now, another type we have is the IUD type, which is simply the intrauterine devices. Now, the intrauterine devices are T-shaped plastic devices that are inserted into the uterus. I mean, these are the deepest, they go the deepest, okay? They're inserted into the uterus and they gradually release a certain hormone which helps to prevent ovulation and thicken the cervical mucus, thereby preventing conception from taking place. The advantage of this is that it is very effective. It's very effective. It lasts for a very, very long period of time. You can even use this for up to 15 years. Yes, you can. So it lasts for a very, long period of time. Women who've had incidences of heavy bleeding, heavy blood loss during menstruation, it helps that over time. Okay, it reduces that heavy menstruation that you have. Disadvantage of this: it can only be done in the hospital setting, and also it does not protect against STDs or STI. I know that it looks as if everything I've talked about is just for women. No, we also have the one for men: vasectomy. Now, vasectomy is simply a procedure that is done to prevent even the sperm from coming out of the man's body. Right now, this is a long-acting type of birth control, because once done, it can last for a very long period of time, and it's actually reversible. Yes, vasectomy is now reversible, so it can be undone. Okay, it is a surgical procedure, so don't worry about pain. Okay, it is surgically done under a sepsis in a sterile environment, so don't worry about infections or pain. Once done right, which are the side effects I'm talking about, you don't experience this, and you don't experience any form of pain or infection and all of that, and it lasts for a long period of time. You don't have to worry again until when you're ready to have kids, or that's if you're ready to have kids at all. Now, one thing I would say about everything I've talked about is that you cannot just watch this video and then decide what birth control method to go for. I would advise that you go to the hospital, because every individual differ. I have talked about the disadvantages of each of these methods for a reason. Simply because if your body doesn't accept this, there is type this. If your body doesn't accept type B, there is type C. That's why you have so many types with the advantages and the disadvantages. It is important that you go to the hospital for you to be given the best advice on the birth control that is suitable for you as an individual, for your body, so that you do what you are preventing pregnancy and you are okay as a person. All right, I hope I've been able to give you detailed information as regards different types of birth control. If you have any questions, please, or you want to enlighten us, let me know, or let us know in the comment section below. And please don't forget to check out my previous videos. If you have not subscribed till now, please subscribe. Okay, and until I see you next time, bye lovelies, and God bless you.